Okay, it is coronavirus day 417, and stay at home day 26. Yeah, so it's only over in like 3 days. Three or anyways, today's cases is 3,436 coronavirus case. This is basically high cases, troubling high cases. So Toronto then at 985 high cases, 714 is from pure high cases from Pure Region, 351 is from York Region, 271 is from the Durham Region, and 194 is from Hamilton. So all other regions have reported under 175 cases. So 16 deaths have been reported. Of course, and then they switched the variant down below. And again, so so UK variants. Of course, we're going to talk about that. Is that now at 75,346, an increase of 3,033. Just terrible. 301 South African variants plus 10, and 920 Brazilian variants, which is plus 45, and the Brazilian variants are really catching up. And there's no word on the India variant, and this is my time to insult the Ontario the federal the Health Canada for not mentioning it, and so the Indian double-mutants were originally at 36 cases, and it largely affected people in Brampton, Ontario. So of course there was also case reports in British Columbia, which was at 39 when it first hit. I don't know if it increased. They never really said. And then there was one in Quebec, which got sort of resolved, and I think it was New Brunswick, or I'm not sure. There's Atlantic Canada. There was some cases there too. So apparently Health Canada is not labeling it as a serious, unlike the other coronavirus variants, and yet if you look at India right now, so that's reported more than 300,000 India double mutant cases and coronavirus cases daily, and not to mention the cremations and body burnings have been involved, and that's just, oh my god, that's just terrible. So if you want to get vaccinated, you have three options. One, one is online, COVID-19 at ontario.ca slash book vaccine. Of course, there's that option. So apparently they're lowering the age eligibility to sometime middle of May. So yeah, keep that in mind. And people will be vaccinated by the Pfizer BioNTech vaccine, not the AstraZeneca vaccine. And they're going to ship the Pfizer Incorporated. They're going to ship a lot of these. And if by phone, is 1-888-999-6488. But the first two options is like if you have to have a special requirement. But if you get recommended by your doctor to get vaccinated. But apparently that option is not available on the website. I have checked, and and it also applies to the same with the toll-free number. Your third option is at a pharmacy, so you will have to wait a lot, and you will be vaccinated with AstraZeneca vaccine, which is slightly less, which is also a double shot vaccine, but the first shot is apparently stronger, and of course there was a blood clot incident. But of course there's some reports saying it's not very effective against the variant cases, so. Well, the Pfizer BioNTech vaccine and the Moderna vaccine, the first shot is weaker, and then the second shot, but effective, and the second shot is stronger. So yeah, but both are effective. So. Stay-at-home rules are until May 5th. The rules are down below, and also checkpoint rules if you're going into crossing into the Quebec or Manitoba for any specific reasons. And if you're going across the Quebec border, please you gotta follow the Quebec rules as well. My focus goes towards Collingwood. So where's Collingwood? Yeah. It's sort of northeastern. So it's basically like a town, like Collingwood's a town that's near like Barrie and the Blue Mountains and Wasaga Beach. Probably around the West Gwillimbury area. So why I want to focus on this area? So two people were like charged for for trying to do an anti-mask and anti-lockdown protest on Saturday. So people gathered in the area of First Street and Huron Ontario Street. So police officers spoke with several people at the scene. So most of them were cooperative. Yet these people failed to comply with the EMCPA order. So the fine is $750 for failing to comply with the EMCPA and there's a $130 surcharge, and there's a $1,000 fine for preventing others from following the EMCPA or the coronavirus regulations or like stuff like that, or stay-at-home rules. And also there's a $10,000 fine for anybody who any organizations that these create these gatherings or like anti stuff that people just need to understand that remember that it's not always these people should know that it's not always your rights aren't more important than the rest of us trying to lower the coronavirus cases and ICU patient numbers, and that these people were trying to go anti-mask, which so that's basically as I'd like to say, stepping back. So instead improvement, it's no improvement. So and enforcement officers have the authority to break up gatherings. And so I'm gonna go to hospitalizations. So 1,925 people are hospitalized with coronavirus. So that's a minus 36. So this literally helps nurses who work in hospitals. That makes their job better with lower cases. That means that people have been vaccinated and they've been free of coronavirus or the variants. There's 889 patients right now in ICU, so minus 6. So that's uh, sort of easier for the. But what I've heard from these nurses at critical care with nurses at hospitals, that it's just I just feel a bit bad that they have to go through so much, like right now, that they have to witness people dying, and even though they try to do their best, not every patient that they take care of makes it the next day. They won't see the light at the end of the tunnel. And of course, some nurses have had they're freaking out, or they would have burnouts, or they just bailed and quit the job because it was too much for them. So so there are 611 ICU patients on using a ventilator. So that's a decreased by 4 minus 4. Oh, okay. Okay, finally they decided to show long-term care home numbers, and it has increased to 3,760 deaths, and 11 staff. Yeah, that number has not changed since months ago, actually. And there's currently 50 outbreaks since the like 10 days ago, I think it was. So we finally know. And not to forget, long-term care homes have had to deal with patients from ICU who's being sent to long-term care homes, and of course they were unprepared for that, which it was like technically a burden on their shoulder. So like think of it as like the ICU sending some of their problems to the long-term care homes, making it their problem. So they're basically making it worse for them, which explains why the cases are now 3,760. So, and of course there were some patients that were out in the hallways and such, and oh, it was just terrible. From what I've heard from long-term care homes. So let's just hope improvements happen for there. So it's only a few days until we switch back to colors on the Tuesday and Wednesday. And once we reach Thursday, we're switching back. We'll see what regions are in what the green, yellow, orange, red, and the gray zone. If hopefully that they could ease it up for Toronto and Peel region, and some other region, but we'll see. Stay safe. So, right, and follow coronavirus safety rules and regulations, and stay-at-home rules. Don't have any large gatherings right now. So once it eases up, so then you can have small gatherings up to maybe 10 people. I don't know, like 5 people at least, but don't exceed that. And then when it's safe, have as long as the people are social distancing, yes, you can. And wear a mask. So follow Ontario and Quebec border rules and crossing for essential reasons, and yeah. And to those trying to break the rules, your rights aren't more important than the rest of us trying to lower coronavirus cases and ICU patient numbers. So we can make this do. Lockdown 2 is over. Stay at home 2 is almost over. There's the light at the tunnel. We can make it.